Let's talk patient advocacy. I decided to ask my surgeon for a chief's review of my case. It wasn't an easy decision, and I've been thinking about it all weekend, but something just wasn't sitting right with me because my next surgery to remove the cancerous lymph node that was left behind during my first surgery was labeled as a biopsy. I ended up sending a note through my chart to ask about that. Maybe it was misscheduled. So the nurse replied to me that it was an excision of my lymph node, so that's why they were labeling as a biopsy. I was kind of hesitant to be the difficult patient, but I, at this point, felt that I needed to ask for a chief to review my case just to make sure that this is really how it should be labeled and that I'm having the right procedure. And my surgeon ended up calling me a few minutes later. Her explanation was that there was certain drop downs that she had to use for scheduling, and that's why she labeled it as a biopsy, even though it was not a biopsy, and she was going to amend the consent form to include language that would mention removing the cancerous lymph node. She had no problem with getting the chief involved and said that she had already spoken to the chief about my case. I asked for documentation of this. I'm asking for a note from the chief in my mind chart just so I can have a record of this. One thing I found out was that this sentinel node mapping is supposed to map out your lymph nodes, including the cancerous lymph nodes. In 5% of patients, that doesn't happen. This had happened recently to the chief and to several other patients. So my surgeon said that she was going to bring this up during the next board review to talk about changing the protocol. In my case, the ultrasound report also contributed because the ultrasound report said that there was one prominent lymph node that was what we thought was the one that we could feel. And it turns out that the lymph node that has the cancer is only 8 millimeters, and the prominent lymph nodes that she removed that were mapped by the sentinel lymph node dye were over 1 centimeters. It did turn out that because the dye didn't map my cancerous lymph node, she mistakenly assumed that the prominent lymph node was the one that was being removed. I was nervous about having some retaliation or just a negative response from my request, but that didn't happen at all. I got a lot of questions answered, and honestly, looking back, if I had gotten any sort of negative pushback, that would have been a decision maker right there. So I encourage you to speak up if you have any questions and advocate for yourself. Your life is too important to sit back and be scared. And that's what I had to tell myself. If I can't do this, then how can I expect anyone else to? And maybe if someone had spoken up before, this wouldn't have happened to me.